Hi, I'm Chris Goss. I'm a professor of medicine and pediatrics at the University of Washington in Seattle, Washington. And I'm also the associate dean for clinical research in the School of Medicine. My research career has focused primarily on cystic fibrosis research, both clinical trials and observational research. And I've been very engaged in clinical trials in CF for the last 25 years. Importantly, I became a member of the ATS in 1999 as a second-year pulmonary fellow at the University of Washington. And membership in the ATS has been a fundamental aspect of my career. I got engaged in the assembly, the Behavioral Sciences and Health Services Research Assembly, and then volunteered for multiple activities within my assembly, rising to assembly chair. And it's been one of the greatest experiences of my life because it's actually added tremendous expanse to my collaborations. It's been key to generating new research ideas, and attending the conference every year is actually a really essential aspect of my annual academic enrichment. My vision for the AnnalsATS is to continue to be a preeminent journal focusing on original clinical, epidemiological, and health services research related to respiratory, sleep, and critical care medicine and population health. I think this has been a really important aspect of the journal's history. I also think one of the key components of the journal is to educate our community on how best to do research in observational and population health studies, but also clinical trials. And some of the key articles that they've published in the past continue to be really critical for investigators trying to move forward with research. And I think that role is important, and we need to continue that role. We also need to continue the role of ensuring that we publish papers that have direct impact on how our patients live and function, and how our clinicians practice. The journal will continue to have an important role in addressing both health policy issues, both in the United States, but also internationally. We're really looking for high-impact papers that are clinically focused. And these are papers that can have studies involving observational research, interventional research, or population health perspectives. The key is these papers need to be high impact and high quality, but also have to have meaningful impact on how clinicians practice. The ATS is really critical for the next generation of clinicians and researchers. We provide opportunities for collaboration, for networking, but importantly, we also provide the science and the research for investigators and clinicians to educate themselves with. And I think that continues. I think there are great opportunities for young people interested in pursuing academic careers in pulmonary, critical care, and sleep medicine in the ATS. They can function as manuscript reviewers. We have early programs for becoming junior editors. And we also have people who gain experience of being associate editors and then deputy editors that can eventually lead to becoming a chief editor-in-chief at one of the journals. So these opportunities are throughout the ATS. There are tremendous educational opportunities in all aspects of the association. ATS membership has many benefits. Not only are there opportunities for collaboration and networking, I think there are great opportunities to stay abreast of the cutting-edge science that is published in ATS journals. I get the table of contents for the red journal, the blue journal, and the white journal and an ATS Scholar every time they're published. And I also get papers in press sent to my email. And that's how I keep abreast. I also think it's really important to be an ATS member because it gives you opportunities to review articles or papers that provide us with a guidance for our clinical care and advances in science in pulmonary critical care and sleep medicine. I go to the ATS website frequently to see what's happening in the organization, but also what's happening at the journals. The website is the great portal, both for educational opportunities, for educational materials, guidelines, but also to read new and in-press articles. I think it's one of the great resources that we have as pulmonary critical care and sleep physicians and practitioners. And I think it's key. You can find materials that you're most interested in. You can search journal articles. It just is a tremendous resource for us as clinicians. And again, you can get the table of contents sent to you, which is also a way to keep abreast of all the newest cutting edge science, pulmonary critical care and sleep medicine.